Welcome to Real People, No Mask Required. You'll learn about real people facing real life experiences with your host, Liz Younger, licensed clinical social worker.
Hello, my name is Liz Younger, and I'm a licensed clinical social worker. I've been in the field since 1988, and today I'm starting a webinar called Real People, No Masks Required. This webinar series will be about real people sharing their authentic experiences. And today I am excited to have my first guest, Michael McNeill. Michael McNeill is a licensed social worker in a large medical facility, and he's going to talk about his experiences since the quarantine and pandemic started. Welcome, Michael, and thank you for being here.
Hi, Liz.
Hey, so I guess to begin and to get this all kicked off, I've been wondering what it was like working in a medical facility as a frontline worker at the very beginning of the quarantine.
Yeah, it was a little scary at the beginning because, of course, not much was known. Things were changing on a daily basis. So every time we thought we had everything down as far as precautions, there was new information that came out, and so people started to get a little worried about what was the correct information, what wasn't, and it was just the fear of the unknown with the staff as well as the patients. I work out of two facilities, and one was a little more common than the other because the staff was a little more seasoned, had more years of experience, and the other one with the younger staff, they were a little more worried. But at the beginning, the big issue was not knowing and the ever-changing dynamic every day with the new information coming out.
So once the quarantine was instituted, as I understand it, you were diagnosed with COVID-19. And I guess, how did you get diagnosed?
In mid-March, they had put protocols in where we were getting our temperature taken at the beginning of the day. And if your temperature was above 95, you were sent back home. So there were people that came in, they had temperatures above 95. They went to medical facilities, but at that time, with the fact that there wasn't a abundance of tests available, they were turned away. So the temperature would go down. They would come back, even though they were possibly infected. So we took the precautions with the wearing the masks and the appropriate PPE for the patients in the facility as well as the staff. And then they started discussing doing telehealth, but some patients obviously had to be on site to get treatment or get examined. So about mid-March, we had our masks on and appropriate PPE, and they were even teasing me because I was going overboard, I was really wrapped up like a mummy. And I had a few days off. I went to the dentist. I just did normal community things. I was off on a Wednesday. By Saturday, I had a fever of 101 degrees, and I had chills that were so intense that my teeth were chattering. And I've read about people who actually cracked their teeth because it was going so hard. And I believe that because it was very intense. I've had the flu a few times before, and this was like a whole new ball game. It wasn't even close. I wished for the flu at the time. That's how bad it was. So they were discouraging people from coming to the emergency room unless they had respiratory issues. So I called the hotline, and they set me up for a teleconference, a video conference, and he took the test, and he told me to quarantine immediately. And then it took about 10 days for the results to come back. And he called me on a Sunday morning about 6 a.m. So I figured it wasn't good news. And he let me know that that I tested positive. He was encouraged that there was not respiratory symptoms as far as shortness of breath. And he just suggested that I follow up with my PCP right away.
Wow, so you had to wait 10 days after symptoms started to get the results.
Right. And they tested for the flu and they tested for COVID-19. So everyone, we were hoping that it was going to be the flu.
You had started to show symptoms and you went about your regular routine, is what I'm hearing. Did you then have to report to those places, such as your dentist, etc., that you had tested positive?
Yeah, I did give them a call out of courtesy, because I also had got follow-up calls from the Center for Disease Control and from the Pennsylvania Health Department, and they were checking in, doing their statistical work, and then they had suggestions for notifying people that they were about to that this had happened. At the dentist, they were really, really particular, really careful, and they had their PP, their protective gear on. So that out of the people that were that I came in contact with, thank God, no one had contracted anything. At the facilities where I worked at, there were other people who had went out, and I found out later that there were several people who had went out before me, but they didn't announce it, of course, keeping their privacy. But in the days before I went out, there were other people that went out, and at one particular facility, there was 2 deaths because and there was no rhyme or reason, because these people were younger than me, they were in better shape than me, and at that point, the early information said that it was more of an issue for people with comorbidities and older people, but at the beginning, at least, there was no rhyme or reason. There were people who were younger who were getting it as well.
So I guess, what were your feelings after you were diagnosed with COVID-19? What was going on inside of you and I guess the people around you?
Yeah, well, we discussed it a lot before, leading up to it, because we had started all the precautions like maybe actually early March, and so we were just looking out for each other, encouraging each other to stay safe, and then encouraging the patients to take the proper precautions. And people were taking it seriously. So when it happened, it was a big surprise, because I said, I did everything. We did everything, and I was surprised to even hear about the people who were affected, or who were already affected, because they were even as stringent as I was. They were even more careful than me, and they still contracted it. And there's no, way. Then we started, thinking about where it was contracted, and did I pass it on to this person, and did this person, because people got it after me as well. So there was that whole guilt piece, like, did I give it to this person? And when I tried to stay away from trying to piece it together, who had it first, like during that whole puzzle thing. And we agreed as coworkers that we weren't going to do that, because it wouldn't serve any purpose. No one passed it on to anyone purposely, and we don't even know proof positive that it was contracted in the clinic or in the medical facility. It could have been elsewhere. We don't know.
I know that you've talked about, again, your personal experiences emotionally with getting this diagnosis. And I thought some of the information, what you've shared with me about that, would be of interest to people who might be watching this. So I'm going to ask if you could share that right now.
About how I felt, like, emotionally. There was a survivor's remorse, especially after the first person passed away, because they went from like 0 to 60. There was no incubation period where they were aware of, where they were like, oh, I'm feeling this, and it was they went right to the hospital, and then they were vented like right away. And so for like a couple of week period, they were non-responsive, and they were vented, and then we got word over a weekend that they had passed away. And we couldn't believe it because, again, this person was in the gym. This person was very active, very um, a wonderful person that was physically was in great shape, and that's the way it went. So then it went to like, okay, well, why her, or why him? Um, why not me? So it went into the emotional part of, I'm glad, obviously, I didn't have those symptoms. I'm glad I wasn't hospitalized, but I didn't want them to go through that as well. So it was that survivor's remorse.
I mean, you've also talked about a certain stigma.
Mm-hmm. Yeah.
And how did you mean that?
Well, I mean, there's when it started, people were like kind of, even the patients were like kind of scared of each other,
Hmm.
scared of the staff, didn't want people to come around, were suspicious. If someone had like a natural cough and even like covered their face or they had their mask on, just like a tickle in the throat, normal stuff, they would say, oh, people would react and ask like to be moved away from them. So it became a stigma. And that was one of the things that crossed my mind uh, when I got diagnosed. Like, okay, so when I go back to work, like, how are people going to react to me? And it was even when I was getting calls from coworkers saying how I was doing, the way they were speaking to me, it was almost like they were expecting me not to come back, meaning like to die, almost, because they just thought, they were so scared that they thought that was the case. And then when the first person died and then the second person died later, that confirmed that in their mind that this is a death sentence. So it's just a stigma of you've had this thing, you're contagious, and even when you don't have it anymore, we don't know if you're still infectious, and so just interaction with you is going to be totally different forever.
So I guess a
We all
question.
have.
Oh, go ahead.
No, I was
A-
saying, like, this is a game changer for everyone,
mhm.
but for someone who has it, they're looked at even with an even stronger tone.
Okay. And like, how was your family with all of this?
They were just concerned about health. They were seeing things on the news, people going in the hospital, people being vented. So I let them know early on because I didn't want any surprises. So I let them know that I had been tested and were waiting, and they were like, oh, keeping a positive attitude. It's probably just a flu or whatever. And then 10 days later, when it came back, I let them know, and they recognized that during that 10-day period, I was still had the same symptoms. That nothing had worsened. So that was encouraging for them. I think if I was in the hospital, it would have been harder for them to take.
But you had to self-isolate at home, correct?
Yes, yeah, I did, and so I was in the room alone, and came out to use the bathroom, and uh, I would go to the like the kitchen because I live with other people, so I would go to the kitchen with masks and gloves on, and all the experts said that was fine. They gave a extensive list of precautions and things to do around the house. So I followed all of that, and like no one else was infected, so it went well in that
Did you
respect.
sense any fear or anxiety with the other people in the house?
Oh yeah, yeah, and the first fear was, oh my God, if they get sick, I gave that to them, and that whole fear of giving it to someone that you care about.
Yeah. But what was their fear? How did you observe that?
Um, they were just spoke about and practiced the precautions. That's all.
Okay.
I didn't get that same stigma that I got from work and from basically from work, because it was a medical facility. So it wasn't anything personal. It wasn't nothing taken personal. It was just we were in the midst of this with people in vulnerable medical situations, and people with comorbidities and immunity issues. So I think that's what brought up that fear at work. at home, it was like, okay, well, you've had it, you had it for more than 10 days now, obviously. And then a lot of friends, got in contact and supported. And one friend in particular, he was checking up on me every day, and he was diagnosed, and he had pneumonia, and he didn't get vented, but he was having serious breathing issues there. He had oxygen on, and he was in the hospital for a couple of weeks. So that was really shocking, because he was, caring for me and looking out for me, and then all of a sudden he was in that situation even worse than I was.
Wow. So have you returned to work? And like, what are some of the fears you have about that?
Okay. Yeah, I'm due to return to work at the end of this month. The doctor's just being extra cautious. There's I'm concerned about how I'll be received. And I've been going a while, so even though patients weren't told that I was tested positive for COVID, patients will be able to put two and two together, because there are other patients that were diagnosed too. And then when they came back for exams and for treatment, other patients hadn't seen them and knew that they were out as well. And so if you're gone for any period of time, people just automatically jump to that conclusion. Another thing about the stigma, I'm noticing when people pass away, if they didn't die from complications from COVID, they make sure that. Oh, they didn't die from COVID. They didn't die from COVID. As if they did die from complications from COVID, they made their death less honorable.
Oh,
yeah.
Wow. I mean, that really gives a spin to it, doesn't it?
Yeah, I'm noticing that on Facebook. Like, oh, I regret that my uncle passed. It wasn't from COVID. Like, wow, really? Like, okay. I mean, I'm feeling sympathy for you because of your loss. I didn't ask for like the autopsy report. So,
And just, as an aside, there are these new numbers that, although technically it's not COVID diagnosis, the diagnoses are related to COVID in some ways, because people are pursuing medical care to address medical issues that are going on besides COVID. And we're finding higher suicides, higher heart attacks, higher strokes, because people aren't getting the medical care they should have been getting.
Yeah, definitely. And, there's reports that there's a disparity in the numbers among African Americans and people from poorer communities in general. And that makes all the sense in the world, because, for instance, when I mentioned that I got the precaution list from the Pennsylvania Health Department. Mm-hmm. And so there were things like isolating in a room. I live in a house. I'm fortunate enough to live in a house that had an empty guest room. Everyone doesn't have that. There's some people who live in small apartments with multiple people. So if I live in a 2-bedroom apartment with 4 people, I can't isolate in the room by myself without seriously inconveniencing the other people. So I think a lot of circumstances like that help to increase the numbers in those vulnerable communities, because they don't have the means to take the proper precautions.
Did you notice any frustration from the minority community, the Black community, about those issues?
My patient population and our particular census at the 2 facilities are it's majority African American, but there are people. There are a cross culture of people, but what they all have in common is the poverty piece. So the frustration came from that, opposed to the specifically the race thing. The main thing was the poverty issue, because they didn't have the means to fully take the precautions that would have avoided helped them avoid passing it on. So in because I had a guest room, I was able to stay there, and that helped to prevent me from passing it on. But there were people, and even patients that I have, who were in smaller apartments with people, and they did pass it on.
And then going along with the socioeconomic piece, there was a lot of people who were furloughed or lost their jobs or were unable to work for whatever reasons. And of course, certain programs were put into place. I guess, what was your experience of that through your patient population? Was that an issue? Was there frustration about, I don't know, the length of time it took or any of that?
Right, because a lot of the older population, they receive a lot of them receive they have Social Security age or retirement benefits age if they work to retirement. So their financial situation didn't change, but their stress level changed a lot. But there were a lot of people who did work competitive jobs, and many of them were hourly wage workers. And so when they didn't work, they didn't get paid. And then they applied for unemployment, and because of the amount of people that were applying, those benefits were taking forever to get to come through to them. So in the meantime, they were financially stressed out. There were people who were work for themselves. That piece took forever to get up to where they were eligible for unemployment benefits. So the financial piece was really stressed people out and caused depression symptoms, and I'm sure in many suicidal thoughts.
So I guess I have two more questions, and then, of course, I'm going to thank you for being on. But the one question is really, this past weekend, there was a lot of racial tension, and of course, it's still in the news. I guess, what's your perspective on that, particularly as it relates to the pandemic?
Yeah, I think it's just I think the frustration over both issues, especially fused together, definitely has an emotional effect, because there's a whole plethora of emotions. You already have people of all persuasions upset because they were quarantined. The financial implications, people losing their businesses that they sunk all their life savings into, the frustration of the two sides, people believing that there's been an overreaction, and then some people being scared and wanting the government to react more. So all of those emotions fused together definitely tip some people over the boiling point. So
do you think that led to some of the chaos we saw this past weekend?
Yeah, it had an effect. I think that the issues have their own things, their own individual implications, but fused together, yeah, they definitely affect each other. They interact. Just because everyone's fried at this point, because it's been a few months now. Our lives have totally changed, and people are on edge.
Yes. And I don't know about your personal experience of what went on this past weekend. How were you feeling about those events?
Well, I mean, I've had incidents in the past with incidents with being pulled over, and there were two incidents in particular where I thought I wasn't treated as I should have been. But I also have several law enforcement and military members in my family. So it's kind of seeing the both sides thing. But I think you can point out a wrong without condemning everyone. So I'm a social worker. There have been social workers who have been brought up on charges or had their licenses taken away because they've done unethical and bad things. I can be critical of them without hating the whole the entire profession. So I think that we can be critical of the situation. You can be critical of the situation and not hate the police.
So one last question, and again, I thank you. What would be helpful for individuals watching to remember or know about your experience and about the experience that they've had during the pandemic, and how to kind of keep focused?
Yeah, I think keep in mind that it's a medical issue, and even if you're having the emotional issues that goes along with that, depression about losing income and stuff like that. You should approach that the same way as as the medical piece. It doesn't mean you're crazy. It doesn't mean you're ostracized or cast aside. Me being depressed is the same as me having a cold. It's a condition that's affecting my functioning, and is treatable. So I would suggest that those who everyone has like the suicide hotlines and there's different emotional health hotlines, even if you're not suicidal, where you can call and just talk things out. And if you're fortunate enough to have insurance that covers counseling and therapy, I would strongly recommend that too, because it's just talking things out.
Right. And the hope is that people who are watching this will hear their own voices through the people that, like yourself, that come on to talk about their experiences. So again, I think you're doing a great service by sharing on such a personal level. Thank you again, Michael. You have a great day. And, I'll see you down the road.
Thank you for listening to Real People, No Mask Required. Real stories, real life events, real people. For more information, visit lizyounger.com. That's lizyounger.com.